Yes, I want to kind of talk a little bit more about treatment planning. Okay. When it comes to treatment planning, two of the most common concerns that new counselors, as I like to call them, Padawans, have in working with clients are reflected in the questions: what do I say and what do I do? Um, while logically these questions are quick, they quickly get trainees lost and off track, which is common when new counselors lack an accurate cognitive map to guide them. To develop an accurate cognitive map, the best guide is for the treatment process. The trainees must first become um, competent at focusing, which means knowing where to focus one's attention when listening and observing. And it can get kind of daunting when you're thinking about dealing with clients because so much is coming at you at one time. It's like, what should I focus on? One of the most useful questions that new counselors can ask themselves and their supervisor is, what should I be noticing and listening for when I talk with this client? The apparent magical Jedi thing that distinguishes master practitioners from average ones lies in what each attends to and focuses on. The better counselors, trainees get at um, focusing, the like the better practitioners they will become. Because highly effective counselors continually develop and refine this art and competency over their careers. The trainees should not expect to master this competency right away. Case conceptualization is the technical term for the therapeutic art and concept and competency of focusing, including an assessment focus, which is central to pattern recognition in a diagnostic formulation, and a treatment focus on pattern change, which is central to the treatment formalization and treatment process. So let's look at the treatment formalization. Elements of the treatment formalization goes as first, treatment goals. Treatment goals are specific outcomes that clients expect to achieve in their treatment, also called the therapeutic objectives and treatment targets. Treatment goals from they formulate from the basis for the work of a practitioner, a therapeutic practitioner, and the client do together. So treatment goals are joint effort. Clinically, useful treatment goals are measurable, achievable, and realistic. And these treatment goals are effective to the extent that they are mutually agreed upon and the client understands them, commits to them, and believes they are attainable. The goals can be short term or long term. Typically, the short term goals are symptom reduction, increase relational functioning, return to baseline functioning, and return to work. Okay. Second is treatment focus. Treatment focus refers to the central therapeutic emphasis that provides directionality to treatment and aims at replacing a maladaptive pattern with more adaptive patterns. Treatment focus is increasingly important as the directionality of treatment has shifted from one non-directive diatom of follow the client's lead to an accountability-based diatom of demonstrate positive treatment outcome. There is a convincing body of empirical evidence indicating that therapists' ability to track a treatment focus consistently is associated with positive treatment outcomes. A common scenario for new counselors, Padawans, counsel trainees, is to get lost or sidetracked in an unproductive discussion with clients. A good example of this is a client reports that they had intended to do the mutually agreed upon homework assignment, but ended up doing something else instead. The new Padawan or trainee or new counselor then asks several factual questions about the circumstances. While collecting more data about the situation, the trainee has unwillingly colluded with the client maladaptive pattern of making excuses instead of taking action. After running out of excuses, the clients then shift to another topic and says that they was really depressed or anxious yesterday, after which the council trainee, the Padawan, proceeds again down the first or second track. Soon that whole session comes to an end and no progress has been made and no change has been effected. Another alternative, if we rewind that, the trainee, the counselor, new counselor, the practitioner can take this track. If they are guided by a specific therapeutic approach, the direction question has already been answered and specific guidelines given for how to therapeutically process the situation. A good instance of this is working with a client who has failed to do the agreed upon homework. The CBT approach is clear about directionality. Focus on troublesome situation which is triggered or exacerbated by the client's maladaptive beliefs or behavior. Here, the new practitioner recalls from the case conceptualization that the client's core belief is that she or he is inadequate and worthless, and that one of their intermediate beliefs is that they try and fail, that they feel worthless, so they don't try at all. And this is not a surprise that the client did not do the assignment and instead make excuses. The new practitioner, informed by this case conceptualization, can therapeutically process the maladaptive beliefs that are activated by the homework assignment. The practitioner knew there was a treatment focus to follow. However, that practitioner still must decide whether or not to follow that directive. The 5 therapeutic approaches when it comes to treatment focus are psychosocial, cognitive behavioral, dynamic, Adlerian, and acceptance and commitment. Okay. Um, Let me go a little bit more into these. The biopsychosocial, the troublesome situation triggered or exacerbated by biological, psychological, and or social cultural vulnerabilities. That when it comes to the cognitive behavioral, the troublesome situations triggered or exacerbated by maladaptive beliefs and or behavior. The dynamic, time limited, troublesome interpersonal situations triggered by the secular maladaptive pattern. The Adlerian, the troublesome situation triggered or exaggerated by mistaken beliefs or discouragement. And finally, the acceptance and commitment is the decreased persistent avoidance and psychological rigidity, and by exploring flexibility process and expanding behavior retour. Um, After the treatment focus comes treatment strategy. And treatment strategy is an action plan for focusing specific interventions to achieve a more adaptive pattern. The, the plan usually involves relinquishing and replacing the maladaptive pattern with the more adaptive pattern, and then maintaining that pattern. Um, when you think of the metaphor of a journey, treatment strategy represents selecting an appropriate route and a vehicle that can reach the destination in a safe and timely fashion. Um, so The most common example is selecting a town car or a sedan, and taking an interstate route is better suited for driving from New York to Los Angeles in 3 days than attempting the same journey with a motorcycle or small sports car and taking country highways. Um, the most common treatment strategies are interpretation, cognitive restructuring, replacement, exposure, social skills training, and psychoeducation, um, support medication and corrective experiences. Usually and ordinarily, one or more of these treatment strategies associated with a given therapeutic approach. Insight and corrective emotional experience are associated with a dynamics approach, while cognitive restructuring, exposure, and skill building are associated with the cognitive behavior approaches. However, some advocate that a range of treatment strategies can be utilized to achieve treatment goals. A good example of this is that treatment strategies associated with the cognitive behavior approaches might be useful and necessary in achieving treatment goals with some clients in a dynamic psychotherapy. Interpretation is a hypothesis or guess about the connection between a client's thoughts, behaviors, or emotion and his or her unconscious emotions or thoughts. Interpretation can focus entirely on the present situation, and it calls upon a dynamic interpretation, or it may suggest a link between the present and the past, called the genetic interpretation. In some instances, the client can gain a new frame of reference and a deeper understanding about themselves and their lives. Um, they go beyond the client's overt words and offer a new meaning or explanation. So when you look at this, insight is central to psychoanalytic psychotherapy, and insight is achieved with the sequence: clarification, confrontation, interpretation, clarification, confrontation, interpretation, and so on. So working through is the process of repeating the sequence until the interpretation is accepted and internalized. Okay. Um, you go into cognitive restructuring, and cognitive restructuring is one of the basic cognitive strategies for helping the clients identify, challenge, and modify maladaptive and distorted beliefs so they become more adaptive. Cognitive restructuring is often considered the first step when using cognitive behavior strategies. Replacement is an alternative to restructuring maladaptive beliefs, and is to replace maladaptive or unhealthy thoughts or interpretations and behaviors with more adaptive and helpful ones. For example, thoughts and behaviors which are more likely to achieve the client's desired outcome. Exposure is a treatment strategy that involves intentional and prolonged contact with a feared object combined with actively blocking undesirable avoidance behaviors. The exposure strategy all involves the process of habituation. Habituation is a form of learning wherein an individual will stop responding or attending to a stimuli like a thought, an object, place, people, or action as a result of repeated exposure. During exposure treatment, usually the client is confronted with a stimulus and which they had previous elicited an unwanted behavior or emotion response. Even though the client will experience increased anxiety in the short term, in the long term, repeated and incremental exposure to that fear stimuli, um, or in the client's imagination or anxiety and avoidance response are extinguished because of the principal habituation. Support And this strategy assists clients to function better by providing safety, acceptance, and caring. Usually, the counselor or therapist provides a supportive environment for the client to reflect on their life situation and feel safe and cared for. Psychoeducation and social skills training. Psychoeducation is a broad treatment strategy of educating and training individuals experiencing psychological disturbance to increase their knowledge, coping capacity, and skills required to solve their presenting problems. So, medication is for psychiatric conditions, and usually is referring to psychotropic medications. And psychotropic medications are chemical substance that influence several brain functions, including perception, pain, mood, consciousness, cognition, and behavior. Basically, there are usually four classes of such medications, and there's analytics, which target anxiety symptoms, antidepressants, which primarily target depressed moods and secondary anxiety and other symptoms, antimanics, which target mania, and finally antipsychotics, which target psychotic symptoms. Okay. Then you have the corrective emotional experience, and the treatment strategy for corrective emotional experience is based on the assumption that insight alone is insufficient to affect a change in a client's behavior. Instead of true change, it's more likely to occur when insight is followed with a corrective experience. And usually, a corrective experience involves re-exposing a client under more favorable circumstances to emotional situations that they couldn't handle in the past. Um, uh, Other things when it comes to formulating a treatment plan and a treatment formulations is a treatment interventions, and treatment interventions is usually a therapeutic action designed to positively impact the client's issue or problem. Treatment interventions are selected based on the treatment targets and the willingness and capacity of the client to proceed with the intervention. Treatment obstacles and challenges. Um, there are so many obstacles and challenges to treatment. Some obstacles may originate from the client's or practitioner, um, the treatment process. And these are factors in the treatment process themselves. Um, I can't, I don't want to go too deep into factors that involve treatment obstacles, but if you just know a client is dependent and avoiding features and and this can be anticipated to have a difficult discussion on personal matters. Uh, so it's like usually clients who have difficulty saying goodbye or have experienced unexpected loss of significant others will likely find termination difficulty. And that's some of the treatment obstacles or challenges that you might run into. Treatment cultural, informed by the cultural formalization. The therapist, client, counselor can decide whether cultural factors are operative and whether cultural sensitivity treatment is indicated. If cultural sensitivity treatment is indicated, the therapist or counselor must then select among cultural interventions. Cultural sensitive therapy or cultural sensitive interventions, uh, the therapist usually plan how these interventions can be incorporated with other interventions, and the specified they're usually specified in the treatment plan. Uh, and treatment Prognosis, the treatment prognosis is a prediction of the likely course, duration, severity, and outcome of a condition or disorder with or without treatment. The prognosis can be given before treatment began to allow the client to opportunity to weigh the benefits of different treatment options. Some practitioners also offer a prognosis based on whether anticipated treatment obstacles and challenges are surmounted. And usually the prognosis range from excellent, good, fair, guarded to poor. Okay, so those are the elements of a treatment formulation, treatment pattern, treatment goals, treatment focus, treatment strategy, treatment intervention, treatment obstacles, and treatment cultural and treatment prognosis. Okay, so those are the key elements, and we'll go into more detail on the next video lecture.